Glioblastoma is by far one of the most aggressive forms of brain cancer. In most cases, you're expecting survival outcomes of these patients to be a few weeks to a few months at the most.
This is an incurable disease, and so these tumors uniformly recur and will ultimately take the patient's life.
If you look at very recent past few phase 3 clinical trials with different therapies that are being used for recurrent GBM, you see that they show good data in a phase 1 clinical trial. They might show you some good data in phase 2 clinical trials. But eventually, when you get to the registration trial, the pivotal phase 3 clinical trial, that's where these drugs end up failing when you conduct a phase 3 registration trial. The big challenge is that patients know that there is an equal chance that half of them will end up in a control arm where they'll get the standard of care, and the other half will get the experimental therapy.
The standard of care treatments for this disease are minimal at best. Even the national guidelines suggest that patients seek out experimental therapies because this disease has just been notoriously difficult to treat.
And that makes it very difficult for a company like us to conduct a successful phase 3 clinical trial without having so many patients dropping out from the study. This is where Medidata, Acorn AI, came into play for Medicenna. Very quickly, we got the full team from Medidata contributing and making suggestions. They were essentially part of our statistical group, not only from the very beginning, but all the way to our meeting with the FDA, preparing our package to submission to the FDA. What we were able to get from the FDA was, in fact, the very first design of a phase 3 registration trial where the majority of patients would come from a synthetic control arm or an external control arm.
And so what was designed here was the use of standardized controls that are matched in every way statistically that we can imagine to look exactly like patients that we would otherwise randomize to that control group. This allows us to use these synthetic control groups to really compare the benefits of our drug to that control group and get a sense early on whether the drug is working or not.
When you talk about dealing with the impossible, and this is basically what we were able to accomplish. Suddenly, the odds of patient being allocated to a control arm is dramatically reduced. We end up creating a situation which is satisfying for the patient, but more importantly, we set the stage for the next therapeutic approach, next combination approach, or for another kind of disease.
I just want to make sure that investigators, patients, caregivers understand the impact that this might have. This will allow us to advance effective drugs more quickly so they're available to more patients, and simultaneously reduce the risks that patients take in enrolling in clinical trials. This is absolutely an incredible opportunity that revolutionizes our field and will revolutionize the field of cancer and perhaps other areas as well.